Hi, my name's Adam. Welcome to the channel. Thanks for joining us today. Today we're going to go through 3 retirement myths that we see Canadians fall trap to all the time. So when we work with Canadians or talk to them, people entering retirement or getting close to retirement, there's the mindset around retirement, and there's a lot of concern that comes with retirement that maybe isn't reality, and it's more of a myth. So we want to go through the 3 primary ones that we see, and hopefully this will walk you through, bring down the stress level, bring some comfort to your retirement plan. And as you walk into retirement, we don't want you to kind of have fears around certain things. So let's go through those 3, and hopefully this really helps you out as you enter into and plan for retirement. So the very first myth I want to talk about is the fact that you need $1 million or $2 million to retire. Okay, that is an absolute myth. Okay, obviously if you have $1 million or $2 million or more, you're going to have a more comfortable retirement. You're going to have more cash flow in retirement. That's that's easy to understand. But if you don't have $1 million walking into retirement, it doesn't mean that you're not going to have a good retirement. Okay, I did a video not too long ago on this. You can search our channel, just search most viewed, because I think it's the most viewed video on our channel. It's got like 80 or 90,000 views. Easy to find. Watch that video as well, and maybe we'll link it up top here as well. But the reality is you don't need $1 million. You don't even need maybe $500,000. It's going to depend on your situation, where you live, your lifestyle, how much CPP and OAS you're going to collect. Do you have a work pension plan that you're going to draw from? Okay, everyone's situation is very different. But even if you have no pension plan, with your CPP, your OAS, and a little bit of savings, and when I say little bit, I mean you still need a fair amount of savings. You probably still need 200 to 500,000 in savings to provide a bit of an income stream to you to live off in retirement. So again, everyone's different. Through the videos, people said, "Oh, you need $1 million or you don't need $1 million." We find most people don't need $1 million unless you go into retirement with debt, whether it's a mortgage or other type of debt. You have a very expensive lifestyle, or you plan on doing a ton of travel and helping maybe the kids or the grandkids, and you have a lot of other extra expenditures in retirement. But for most Canadians, your CPP, your OAS, and 200 to 500,000, again depending where you live. If you live, in Vancouver, Toronto, or expensive area, it's going to be a lot more money, obviously. And I know a lot of these videos I do, you guys pipe back in the comments, which I appreciate every single comment. My numbers aren't realistic. CPP numbers or housing prices. Look, I go off based off a lot of the clients that walk into our office, and I'm based just outside Vancouver. So a house down the street just got listed for $1.8 million. It's insane. I don't live in an expensive area, but I live in an expensive area. So, that's just reality, living close to Vancouver, close to Toronto. So that's who we see walking into our office. But even locally here, like when I meet with people and they have $500,000 walking into retirement, CPP, OAS, no, benefit plan or no pension at work, they still have enough money. So don't get trapped into that, I can't retire because I don't have $1 million. That is a myth. Make sure you plan so that, the amount of money that you do have, is it enough for retirement? You need to figure that out. You need to break down the numbers and make sure you can live off what you've saved, but you don't need $1 million unless you have, again, a higher, type of lifestyle or travel, whatever it is. So hopefully that helps you and eases some of the stress around that $1 million mark that so many of you kind of target. Again, it's a great target to hit if you can hit it, but so many of us can't. Okay, it's expensive to live, it's hard to save money, and we all want to retire one day. So if you retire with 300 or 500,000, it may be a bit less for income, but it might meet your needs, and it probably will. Before we jump into myth number 2, if you haven't already subscribed to the channel, hit the subscribe button below. It costs you nothing. It takes 1 second. And if these videos help you in your retirement, if they give you information, if you appreciate them, please hit the thumbs up. It really does help get these videos out to more people. We see it firsthand. The more thumbs up we get, the more these videos get out, and we really do appreciate you watching, viewing our content, and subscribing to the channel. So the second myth is that healthcare costs are going to bankrupt you in retirement. And healthcare costs are a very, very valid concern when you enter retirement. But you have to remember that, we live in Canada and we have one of the best healthcare systems in the world. You can make an appointment with your doctor tomorrow, go see them, and it costs you nothing, right? That's part of our taxes that we pay. And, I know I'm going to get lots of comments below on this, that we have a terrible healthcare system, whatever. I know many of you have had very bad experiences. I have close friends and families that have had very bad experiences through our healthcare system. But in general, we do have a good healthcare system compared to the rest of the world. And if something happens to you in retirement, most likely you can get care for that ailment or whatever it is for zero cost. Now, obviously, there's kind of drugs and dental. Those are some of the main costs, especially drugs. If you're on an expensive drug, that can get quite costly. So do be aware, though, that every province or territory has some sort of prescription drug assistance, essentially. So in BC, we have Fair Pharmacare, and that's based on your income. So the government will step in and help out and cover a lot of the costs and at some point all of the costs of medication once you spend so much, and it all depends on your income level. Okay, so if you have, let's say, 30 to 32,000 of income, they're going to cover so much up to a certain amount, and then 100% once you spent, say, $2,000. So there's different breakdown on depending on income. Okay, in Ontario you have the drug benefit program, so that's the benefit of Ontario. Every province and territory has some sort of drug benefit program that's going to help subsidize your drug costs. Now, I want to be very cautious on that. Not all drugs are covered under this. Sometimes it's only generic. So we've had clients that have been on Fair Pharmacare in BC for many years, and over time their drugs, aren't covered. They go to refill a prescription, and the drug isn't covered anymore, which is crazy. But so the plans do change over time. You might have to go to generic. That may not be the best for you. So it's not guaranteed that you're going to be covered under this. So do your homework. If you're on some medication walking into retirement, see if it's going to be covered under Fair Pharmacare, the drug program that you have in your province or territory. But be aware that healthcare insurance in retirement is very expensive. And when I break it down for most clients, we look at what's the cost going to be on a monthly basis for you. And usually it's going to run between $250 and $500 every single month. Then we look at, okay, well, what do you get for that? Like, is it covering 80% of dental and 80% of prescriptions? Like, how much are you going to use in general? And when you break it down, sometimes it makes sense to go to the healthcare option, and we've done that for a few, but the majority, it doesn't. And I get it. You may, 5 years down the road, go on a very expensive medication. Again, most provincial, subsidy programs will help pay for that, if not all of it. So just be aware of that. Check into that before you panic and you think that healthcare costs are going to wipe out your retirement plan. Whatever province or territory you live in, we put a link below. Actually, you can find your province or territory and check into what healthcare options are there, what support is there. And I think that'll ease a lot of stress and discomfort around the healthcare costs, prescription costs, and how that works. One note here, if you have a healthcare plan at work, sometimes you can continue with that through retirement. Okay, a lot of government jobs, you can continue with your healthcare through retirement, and a lot of those are priced really well and are actually a good plan. So, if you do want to look into a healthcare plan, Manulife and Blue Cross have decent coverages, but check with your work first. You might be able to continue with coverage at a really good rate. And the last thing I'll say on this is most healthcare plans have a lifetime maximum. So, it might be $200,000 or $300,000 or $400,000 of lifetime maximum claims. Okay. If you've worked for a company for 40 years and you've been making claims over those years, check what your lifetime claims is. It might be at $100,000 or $150,000 already, and your maximum may be $200,000. So, it may be a great plan to roll over on, but you may hit your lifetime maximum sooner than you expected. So just be aware of that. That's one thing we've seen clients kind of run into or they're not aware of. So just be aware of that as well. And the third retirement myth is I'm going to run out of money. And definitely there's a few of you that will probably run out of money. We get calls from people, we've met with people over the last 16 years that say, like, I basically have to tell them, like, we really have to, run a tight ship here. You only have so much, maybe you can't work anymore or whatever it is. So there's definitely gonna be some of you that have to be very careful not to run out of money. But The reality is most of you don't enjoy retirement in the early years and have too much money in the later years just because you haven't planned. Okay, so make sure you do proper planning heading into retirement. This could be something you do on your own. You could use an online resource, you could hire someone, whatever it is that brings comfort to your plan, and to make sure that it's clear and you can actually follow the plan. Okay, but we see too often that people don't spend money early in retirement for fear of running out later. And then they get later on in retirement and they have way too much money. They're never going to spend it. It just gets passed on. And every single one of those people wish they had spent more in the early years, whether it's travel or lifestyle, whatever it is. There's so many ways that all of you spend money. I'm not here to judge how you spend money, but you should make sure you have a plan so you can actually spend the money, enjoy it early in retirement. Okay, so in retirement, there's and there's so many of you that fight me on this, but there's the go-go stage, the slow go stage, and the no-go stage. Okay, and there's different costs to each stage. Okay, the go-go stage should be like you retire, you're traveling, you're spending money, you're enjoying life, you're healthy, right? Hopefully you're healthy. I know all of you aren't healthy when you retire, but if you're healthy and you can kind of enjoy that go-go stage, make sure to enjoy it. Life does slow down at one point, and it really slows down later on in life. Now, a few of you have commented, the no-go stage is the most expensive part of life because you're in a care home and they're $7,000 to $10,000 a month. Okay, that's an exception, and also those prices for care homes are an exception. That's not the reality for most. So, in general terms, and we do these videos in general terms, you have a go-go stage, a slow-go stage, and a no-go stage. Don't save all your money for the no-go stage because you don't need it. Okay, spend money up front, but make sure you have a plan so you have enough money later on. Okay, that's very important. I'm not saying blow all your money early, have nothing later on, but have a plan so that you don't get to your 80s, 90s with a ton of money in the bank account or your savings and you didn't enjoy early. Hey, if you get to the no-go stage and you have lots of money, but you enjoyed it earlier, perfect. That's great. You can pass more money to kids, grandkids, charities, whatever it is. But make sure that you have a plan so that you can enjoy the early years of retirement. And my last point on the running out of money is I see too many people de-risk too heavily in retirement. So people say, I'm 60 or 65 and I'm retiring and I need to pull my risk right off and I'm going to GICs or I'm just going to go in a high interest savings account, which right now you're losing to inflation. So you're actually losing money every single year. So remember that when you hit retirement, most of you are not taking out all of your money at once. In fact, you're probably spreading it out over the next 20 or 30 years. So be aware of that, right? Your time horizon is not a month or a year or 2 years, most likely, for your money. It is 20, 30 years. So make sure you continue to invest it as, a time horizon of 20 or 30 years. Don't look at, I can't take risks because I'm retired. That hurts a lot of you, right? If you're losing money to inflation every year, or even if you go so low that, I'm getting my 2%, I'm keeping up with inflation, you're not letting your money grow for you, okay? I'm not saying go out there and take more risk in retirement, but just make sure you have a really good investment plan. Work with your investment manager. Again, I'm a financial planner. I'm not an investment person. I've been clear on this channel with that. That's not my strength. That's not what I'm trained to do. But I am trained to help with financial plans, help you retire better. And part of that is making sure you don't de-risk your whole portfolio when you hit retirement age, okay? It's important to make sure maybe you pull it back a bit if that's your comfort level, but make sure, that it's somewhat, invested, earning the most that it can based on the risk level that you're willing to take, okay? So work with an investment professional that understands that side of the business. And make sure you don't just pull everything in cash because, again, you're losing to inflation and it's going to hurt you long term. So, fear of running out of money, if you're losing to inflation every year, there's got to be more fear. So let's alleviate that by not de-risking everything when you hit retirement. So hopefully this video helped kind of, demyth some of the myths that are out there around retirement. Again, everyone has kind of their own fear and concern heading into retirement. These are three of the main ones that we see. Again, you may be on an expensive medication that's not covered by your provincial healthcare, and a healthcare plan may make the most sense, or else it will bankrupt you in retirement. So they're the outliers. We get that. The outliers are there. We make sure that we look at that when we put plans together for clients. But at the end of the day, these three items that I talked about today are retirement myths. They don't have to be part of your kind of a cloud in your head entering retirement. You know, have a plan, follow the plan, and you'll enjoy retirement that much better. So hopefully this helped you, and we'll see you in the next video.